GLP-1s or weight loss medications could impact your eye health in rare cases. That's the warning from the American Optometric Association. That's why they are advising people on these drugs to pay attention to any vision changes. But is this something that you really need to be concerned about? Well, we are fact-checking this for you. I'm here with Dr. Bijoor, so thank you so much for joining us today.
You're welcome. Thank you for having me.
I read a statistic that about 12 to 14% of Americans are on these GLP-1s.
Yes.
So that's a huge amount of people on these medications, yes. And that's why some of these eye doctors are just letting people know, be aware of this. So what should people know about vision and GLP-1s?
So it's a real concern. It's a very rare side effect, but especially in patients that already have diabetic retinopathy or have age-related macular degeneration, there have been cases of worsening retinopathy. There have been cases of worsening vision. So it's important to be mindful and aware of that. Also, there have been some cases of sudden visual loss in one eye, painless. And that's a specific condition called NAION, non-arterial ischemic optic neuropathy. That's one of the most significant ones that, is unilateral vision loss.
Yeah, and we have that there on your screen as well. So this is what the studies have shown is associated with some of these GLP medications in rare cases. So what does this mean? I mean, is this something people should really be concerned about?
100%. As a clinician, when I start these medications, I mention to patients the side effects, and then I also mention the rare side effects. So you should always check with your physician. If you always get an eye exam anyway, these meds have been around for 20+ years. We've been using them for diabetes. Now, last 5 years, they're FDA approved for obesity. So that's opened these medicines up for a much larger population. And so it's really an important thing to have your eye exam once a year. So you know your baseline, you know your risk. And in certain populations where you've had erratic blood sugar control, when you start taking the GLP-1s, all of a sudden there can be fluctuations in your glucose control. So that's one, thought is maybe that's what potentiates
causing the issues. So what are the symptoms to look out for?
Sudden vision loss in one eye, which is painless, blurry vision, cloudy vision, colors are hazy, anything that's out of the ordinary. I mean, if you wake up with dim or haziness in your vision, it's important to get notify your family physician or your optometrist or your ophthalmologist. Optometrists are also trained in inner eye exams, and ophthalmologists are physicians, they're MDs that have gone through surgical training for the eyes. So must let them know.
Now, some people, they get GLP-1s online, but I know you emphasize make sure you go see someone in person. Yes. Why is that important?
Really important, because these medicines are branded medications. They have data, they have evidence. There's a lot of, studies that have gone into saying scientifically, every medication has a risk and a benefit. So as clinicians, we are trained in understanding the risk for that patient. And there's a big void when you take something online. There's no way that online provider is not really examining you, listening to your heart, lungs, there is a limitation there. Also, there's dosing variability when you take a compounded medications. There are also some cases a concern for, is it underreported? Maybe they have side effects, and there's no real regulation or systematic regulatory. Yes, for the compounded, whereas for the brand, we have a adverse effect reporting data tracking system. So there's a way to notify the company, notify the FDA. So obviously those cases have been reported. But with compounded meds, we just don't know. So I highly recommend, if people are getting it online, make sure you're letting your family physician know, your primary care physician know. Now with the costs of these meds have gone down, it's really much more feasible to go see your physician in a brick and mortar practice and understand the side effects of these meds. We also are microdosing once the weight loss is achieved. Sometimes we have to go up on the dose. With compounded meds, you really don't know how much of the active milligram you're getting, because they're made in the pharmacy. Yeah. So I think there's some limitations there. But knowledge is power. Make sure you discuss that with your physician and really be up to date on the data that comes out there. So.
All right. Well, thank you so much for breaking all that down. Again, a rare condition, but good to know about just in case.
Yes.